Hi, everybody. Hi. It's Dr. Haisha, the mommy dentist, and I'm coming on. Just want to make sure. Hi, everyone. Yes, welcome to the mommy dentist. It's Dr. Haisha. I'm wearing two hats. I'm here for my patients at Tucson Smiles Pediatric Dentistry. Dr. Priya and I wanted to just get some information out there to our patients, and we thought this information would also be useful to those in my mommy dentist community, readers of my book, my new book, Cavity Free Kids, that we had some tips. I know this is a tough time. We're all kind of figuring it all out together, especially parents now with new roles of helping the kids get through their remote learning and managing everything else and making sure they're staying happy and healthy. Um, what I wanted to talk about, though, are some tips that I'm noticing myself as a mom and seeing what's happening with the kids at home during this COVID-19 pandemic that I thought I should share with you guys. So the 5 tips, I just want to make sure we're all on. Yeah. So five, you know what? I'll just have to just be honest right now. My comfort zone is talking to my pediatric patients, my little kiddos. And guys, if you're there, moms, if bring them on in, let me say hi to them. I miss you guys so much. I hope you're still brushing and listening to your parents and making sure you're flossing before you go to bed. But there are a few things that I'm noticing here. So I'm sorry, my comfort zone is talking to kids, but I'll do my best on this live. Um, what I'm seeing is my 3 kids. If you don't know me a little bit more about me, I'm a mother of 3. I have a daughter who's going to be 16 next month, and she's a little sad because probably her driver's license test is going to be postponed a bit, but she's getting through her sophomore year. And I am a mother of twins who are 12 years old. They're in 6th grade. And I had to go find a quiet spot because everyone's all spread out in the house doing their online schooling. But my son in particular, so no one tell Nicholas I'm talking about him, but I see that boy going to the pantry like at least 5 times an hour, just getting stuff, just snacking. And one of the main tips I wanted to talk about today on this live is just kind of monitor that a bit. Not that he's going in and snacking on chocolate chip cookies, but things we don't think about that can cause cavities. And some of my patients have heard this spiel before is let's watch out for the starchy snacks like the crackers, the dry cereals, the chips, of course. So these are refined carbs. And the carbs break down to a simple sugar. Okay. And so the bacteria that lives in our mouth that we call our sugar bugs, they will feed off of any type of sugar. Now, if it's already broken down to a simple sugar, it's easier for the bacteria to digest it. So just think about this. It's not the sugar that causes the cavity alone, and it's not poor hygiene and plaque buildup that causes decay. Okay, it is a combination of the two. It's when the bacteria feeds off of the sugars, the byproduct is acid. Okay, and so the acid is then what breaks down the tooth, makes a hole in it, and then you get a cavity. So during this pandemic, as you all know, dental offices across the globe are closed. We're still open for emergencies, and Dr. Priya and I have got quite a few dental emergencies because things happen. We're at home longer. We're trying to find activities to play, and I've had several accidents of kids falling off their scooters and hurting their teeth. So trauma is a big thing. So we are available to help you guys with that. But we can't be in the house with you to remind them on the brushing and flossing, which I know you're doing, but sometimes they listen to others, to the dentist over their parents because you can say it till you're blue in the face. So let's limit the sugars because we don't know when we're going to be able to get you guys back into the office. And so I don't want this habit to start developing where they're snacking constantly. One, are they bored and just snacking just out of habit, or are they think they're hungry but they're actually thirsty? And that's another tip I wanted to talk about, is to make sure they're still keeping hydrated, getting enough water. Just really have them. At school, my kids would take their water bottle full of water and drink it all day. But if you're home, sometimes that's just not there, and they kind of forget to drink. The water not only helps keep you hydrated, it's good for our saliva, keeps the saliva plentiful to help buffer the acids in the mouth. So let's just kind of jump into that area. And I'll, at the end, of course, I'll be happy to answer any questions, but I'll just go through this. With drinking the water, just make sure that they are limiting the juice and having water in between meals. So with the snacking, the chips, the crackers, pretzel sticks, just make sure if we're going to have a snack like that, to have it maybe with a meal and have and also if they're not having water, because they want water, of course, but if they want to have a cup of juice, it's best to have that juice with a meal when they're sitting down eating. And the reason for that is as you're eating, your saliva flow increases. And our saliva helps to neutralize the acids. So if they're having a challenge, acid challenge in the mouth by eating something that's a little bit sugary or sweet or starchy, then the saliva can help neutralize those acids to bring the pH level back up a bit, can neutralize the mouth. So the mouth is not so acidic and can help kind of limit those cavities from developing. Okay. Take a breath here. So we talked about the snacks, the starchy snacks. One other thing too, some other easy go-to snacks that I've noticed, and this is just from being in the practice or just being out, is not only the convenient snacks like the dry cereals for our toddlers, but the Go-Gurts or the yogurts that you suck that's in the little, like the popsicle sleeve there. Because when they're, and also the pouches, like the applesauce pouches, is very acidic. Those are very acidic. So you kind of see a toddler or young kiddo just kind of sucking on that throughout the day and long durations of time. I have seen decay develop on the backside of those upper incisors. So I would prefer to have the whole foods, the fruits, the apples and the veggies, these whole foods. One, they're harder for the bacteria to break down, and they're an excellent source of fiber. So other snacks, at the end, we're going to share a recipe, a fun little recipe you can do for some different snack options. But just always remember the go-to are dairy, the yogurts, cheese are great calcium boosters and great for our teeth. Fruits and vegetables, of course. So those are those snacks that you can kind of think of. What else did I want to talk about? Oh, gummies. Oh, the attack of the gummies. You know how I am about gummy vitamins. Like, I don't even know why they're out there. Like, we all grew up on hard, chalky Flintstones, and we all survived. So I know it's easier and it's yummier for the kids, but those gummies, and if they're not brushing well before they go to bed, they are stuck on the teeth all day long. Pre-COVID, and when we finally get out of this, just remember they're having a vitamin that's sticky, and then they're off to school all day and they haven't brushed, and let's say maybe they missed a brushing that evening. The sugar, the fructose syrup of the gummies is kind of stuck in the teeth all day long. So it's like a picnic for the bacteria to feed off of and releasing those acids and just breaking down the teeth. So gummy snacks are another culprit. So if they're going to have that, and believe me, I mean, obviously, I am fighting the fight with you guys. I'm not saying that my kids don't ever have any sugar or sweets or anything, because we've made all sorts of desserts while we've been home during COVID. But you just got to make sure to brush afterwards. I just don't want it to be a habit. But speaking of habits, that's the other tip. Just make sure we are staying on a routine, staying on our schedule. That's one thing my husband and I have done or tried to do. The effort is there to keep the kids on a regular schedule for school, and they're making sure they have the homework time, downtime, outdoor time, exercise time, but also getting up at the same time, going to bed at the same time. So still the routine of brushing when you wake up in the morning, or if your family brushes after breakfast, stick with that routine. The routine of brushing before you go to bed and flossing your teeth before you go to bed. And one other tip I wanted to add to this list is just to make sure the kids wash their hands before they brush their teeth. We want to do everything we can to just stay healthy and bust all those germs out. So wash your hands, stay in your routine, brushing twice a day, flossing once a day before you go to bed. Okay. All right. So we have talked about snacks, we've talked about the gummy vitamins, drinking our water, brushing, keeping our routine. And then, as I mentioned earlier, the emergencies that we're getting, busting a lip, fracturing a tooth, pushing a tooth back a bit from impact. It'd be great if parents, if you have Otter Pops available or popsicles, maybe keep those handy in the freezer. The first thing I usually do when a parent calls and they're sending me a picture of the injury, there's oftentimes the lip gets busted. So ice is always great. So if you have some ice packs, that's wonderful. A cold popsicle is great because the kiddos are sucking on that and that can help with swelling. So keep a popsicles on hand, ice pack, a bag of frozen peas works great too. Um, Children's Motrin, like Tylenol or Motrin, but Motrin, has the anti-inflammatory agents in there, so that will help with swelling. And then gauze if you have it. A few calls have come in. We've got some loose baby teeth hanging on, and parents are needing some help on getting those out. I'll try to download some pictures for you guys. So one thing, if you do have a loose baby tooth, or let's say this is that common thing that happens. Let's see. Oops, sorry. Okay. This happens a lot. You see those adult incisors coming in behind the baby incisors? It's fine if the baby teeth are loose, because then we'll want you to try to encourage the teeth to loosen up so they wiggle and come on out. And then don't worry, over time, the force of the tongue will push those permanent incisors back into place. But if a kiddo doesn't like to wiggle their teeth, that's when you can kind of help out. And you can never really take out a tooth too early. I mean, it'll be really hard to. So if it's loose, it's fine. Some parents are like, it's loose, but I don't want him to mess with it. I want it to come out. It's okay. If it's really bothering them, one thing I can always recommend is just having them suck on a cold popsicle. Kind of coldness numbs the tissue a little bit, and just stretching it with a little bit of effort that is a little bit sore. I kind of tell the kiddos, it's like if you had a sore muscle and you stretch it and it's a little bit sore, but the more you stretch it, the looser it gets. Well, that's what we're doing with the gum tissue that's holding on to that loose baby tooth. You kind of wiggle it out towards your lip, hold it a few seconds, about 5 seconds, a little soreness, then move it back a little bit, kind of even a twisting action will help loosen up those teeth. But the tooth fairy is still working during this pandemic, so help them to get that out. So that's some little fun thing to look forward to. What else did I have? And then we'll go to some questions. 6-year-olds, 7-year-olds, this is a time when their adult 6-year molars are starting to come in the back behind all their baby molars. And a lot of times I was kind of explaining, oh, look, I have my model. This was one thing I actually still had in my car from a dental fair I went to. Here. So as the molars coming in, sometimes the gum tissue is still over the tooth. And here's a picture. Oh, shoot, I have my picture. Here we go. You see it okay? See how the gum tissue is still overlapping that permanent tooth. So when that happens, food, plaque, bacteria, debris just kind of gets trapped under there. I call it kind of like a plaque trap. So cleaning the area is the best thing to do. Rinse with warm salt water, still brush at an angle where you're actually getting under the gum tissue to get it all cleaned out. If you have like a medicine syringe for the kids' medicines, and just fill it with the warm salt water, or if they just hate salt water, don't worry about it, just as long as you're using some fluid water to get in there and then flush it out. You can just get the tip under that gum tissue and flush out the debris, and that will help. But keep brushing it, keep it clean. It will bleed a lot just because that tissue is really inflamed and angry and sore. So, but the more you do that, the faster it heals, and then the sooner the tooth can come in. And let's see, if they should bite their lip or have an ulcer on their lip here, we call that an abscess ulcer. Warm salt water rinses are great for that, to help it. Well, the saline solution when you're making the warm salt water, and it's just like a cup of warm water and a teaspoon of salt. And if you have a sore in the tongue or inside the mouth, this is good to rinse with. The saline solution helps to kind of slough off that dead tissue that's been ulcerated and help turn over the cells to help it heal better and faster. So do that, as well as avoiding any acidic foods and drinks. Of course, like your orange juice or lemonades, bananas. We don't think about bananas, but bananas are a little acidic. And tomato-based things. So we've been making a lot of homemade pizzas, which is fun. But the tomato sauce on the pizza or spaghetti or lasagna can aggravate it a little bit. So just kind of a bland diet. Those usually heal in about 3 to 4 days, 5 to 7, just depending on how big they are. And anything else? Oh, this is a picture of just a kiddo who fell and bumped their baby tooth back a bit. The first thing you should do immediately is to get some ice on it. So either the popsicle or put an ice pack on and call your dentist. So like I mentioned earlier, the dental offices are closed, but we are on call for our patients. And a lot of dentists are doing teledentistry, just like we are at Tucson Smiles. And once you reach out to the number there, then the dentist will either have you take some pictures to send by email or actually get on a video chat with you so we can walk you through the next steps. With the executive orders of only not that non-elective treatment, emergency is the only thing, the elective treatment is we can't go in for. But if there's been any bleeding that can't be controlled or any changes in the bone or the facial structure, of course, abscess or infection. And let me just remind you guys, an abscess will look like a little pimple on the gums. I see there. So it'll be adjacent it can be it's usually on the cheek side, but sometimes it can occur on the tongue side of the tooth. But if there's a tooth that's been affected or had a fracture and the nervous has died, then you'll see the abscess. So you'll need to contact your dentist so you can get on antibiotics. We do come in for extractions of those. So just reach out to your dentist if you're not one of our patients on that. Well, guys, let's see. And of course, I just have to share that my book has a lot of this information. It has tips all through the ages, even beginning at pregnancy, what expectant mothers can do to stay healthy, keep their oral health up, what they should be eating for the dental development of their child's teeth, and then how to care for their teeth, tips on brushing, oral hygiene, dental developments, common dental concerns that we have at different stages from the first year of life through their toddler years, their school age years, and then their teenage years. And like I said, I have tweens and a teen and some of their friends. We're getting more of them, seeing them drinking more of the energy drinks, the Gatorades, the snacking on the hot, spicy chips, how that erodes the enamel off the teeth. So I have lots of pictures there, and just wanted to highlight that there's a whole chapter on crackers, cereals, and cavities. Oh my! Little demonstration of how to assist your child with brushing, and then all these resources like this dental emergency guide, along with habit tracker calendars, how to wean your child off the pacifier or harmful habits like sucking their thumb, is all on the website themommydentist.com. Here's like one of the resources on the dental emergencies, on common things on how to handle them. So I just felt like during COVID, when it's hard to get into the dental office, these are some things that or I guess a resource you can have to help your kids grow up happy and healthy smiles. Because remember, oral health is a part of our child's overall health. And I'm just here to share my experiences and practical tips because my kids are not perfect and I am not perfect. So we're all learning together, but at least it's just a resource to have. You can get it on Amazon and barnesandnoble.com, or you can just go to themommydentist.com and get 7 downloads that are free and how to order the book. And how about questions, I think? Yeah. Okay. Thanks. Hi, Donna. Good morning, Sherry. Hi, Sherry. Okay, good. I think that's all. I know this will probably be shown on, you can see it on the replay. I also wanted to offer this, that I'll be here every Mondays with the Mommy Dentist through April. perhaps maybe I can do some curriculum for your kids, maybe on the science of dentistry, just to give you a little break for our younger ones where the parents are very having to be very engaged in their learning. I do have it a little bit easier now that I have sixth graders and a 10th grader. So I feel full of everyone who's trying to do it all. So maybe next time have the kids come on and we can do a little activity together. But I'll let you know. I'll put it in the Mommy Dentist Facebook group. I would love it if you could share this with a parent you think could find value from it. Just know that also for our patients at Tucson Smiles Pediatric Dentistry, Dr. Priya and I, we miss you all so much. We can't wait to see you again. If you have any dental concerns, emergencies, please give our office a call. Okay. Have any questions? Trying to think. Well, I'm just going to scroll really quick if you guys don't mind. Okay, but if you're coming to this a little bit later, oh, tips on brushing. Clarissa, thank you. I should. That's why I have my whole model. So if you have an infant, actually there's a great video that someone, well, not someone, I can tell, she won't mind if I tell you. My sister and with my adorable nephew, Julian, she showed how I taught them how to brush his teeth on a changing table. You could do it on the bed, on the floor, but having them laying back with their head in your lap or on the bed, you can see better, and then you can brush their gums and their teeth. We want you brushing as soon as the teeth start to erupt. And if you do have a baby and they're about to approach their first birthday, as soon as we're back open, make sure you call your dental office to schedule them for their first dental visit. Before the kiddos, like the toddlers, like I showed you in that one picture, if you have the kid standing on a step stool, looking in the mirror and facing away from you, it's a good way for them to see how you're brushing, and then you can actually see a little bit better in case they're squirmy. But with the toothbrush, you're going to go in little circles. Oh, sorry, didn't show you. Little circles, angle the bristles at a 45-degree angle. Go in little circles like that. So I always say on the lip side, brush your teeth in circles because the plaque is going to develop along the gum line first, right? So you want to go in little circles. And then behind the teeth, so on the lip side, the tongue side, little circles, a 45-degree angle. And then where they chew their food, back and forth, back and forth, back and forth. So if you split up the mouth in quarters, you want to do the upper left side for 30 seconds, the lower left side brush for 30 seconds, and then so on and so forth on the right. So you get a total of 2 minutes. The 2-minute sand timers are great. Put 2-minute timer on your phone. Play a song on your phone and say, we have to brush until the song is over. So I like a manual toothbrush until they're about 6 or 7, where they have better manual dexterity to brush on their own. And then also too, I like the Sonicare toothbrush and the Quip toothbrush. Quip is great. I love it. In fact, I have one. And with us, depending on delivery services so much more now, Quip will automatically send a toothbrush head every 3 months to you. And that's another tip I wanted to add. Just make sure that we don't forget to switch out our toothbrushes every 3 months. And then flossing. I don't have floss to show you, but yes, floss between the teeth before they go to bed. I'm fine with the floss sticks. If you go to the mommydentist.com and then scroll over to the videos, there's a video on demonstrating on how to brush and floss. So you can do that as well. Thank you for that great question, Clarissa. Okay, well, that was fun. I hope you guys learned something. Thank you for love and support and understanding while we're closed down at this time. We are all thinking and praying for your families. We're hoping everyone stays safe. This is a surreal time we're living in, but we will come out of it. But our hearts and prayers go out for those affected and our healthcare workers on the front line. My husband is a physician, so I know how scary it is. He's not in the ER all the time. He was in the ER last month treating patients with seizures because he's a neurologist. So it was a little scary time. So we're doing our part, staying home and to keep everyone else safe and healthy. And the last thing is in the stories, there's going to be a cool little recipe for a fun snack. That'll be fun for your kids to assemble with you, it is watermelon pizza. So it'll be watermelon, you cut it up in quarters, and then you can put, well, in watermelon, it has great antioxidants, helps to reduce the inflammation. We want to stay healthy. And then rich calcium yogurt, use Greek yogurt, whatever kind of yogurt your kiddos like. And then top it off with your favorite fruits, strawberries and blueberries and mangoes and oranges. And it's, kids eat color and they're going to love making it with you, and it's going to be yum and tasty. So, hey, take a picture of you guys making that, maybe post it in the Mommy Dentist. I would love to see that. Pictures of your kids brushing, I would love to see that. And as always, you can reach out to me on our community page. This is for us. If you have questions, comments, everyone's here to help raise the next generation of cavity-free kids. Thank you so much for your time. I hope to see you again next Monday at 11 a.m. Pacific time. Have a great day.